po. Si Lance po ito. Okay yung anak ko ni Dr. Joson. Pasensya na po, may kasi siya. May prior commitment siya today. Pero may ready pa rin po siyang lecture for today. Papakita ko na lang po. Kung may questions or clarifications, na lang, sagutin ko na lang po yung mga questions, clarifications, tsaka yung yung mga picture taking, mag-facilitate in the middle.
Doc Lance, before we start, we'll have our picture taking first.
Pala si Abet. Hi, Abet.
I'm here. So please, everybody, turn on your camera. We're going to have our picture taking before Doc Lance starts his lecture. Yeah.
Good afternoon po sa lahat.
Everybody, I would like to introduce to you Dr. Ray Benjamin Lance Joson.
Hello.
We will do the lecture instead of Dr. Joson because Dr. Joson has a very important appointment. So may I request Chris, Charlita, Mel, and Arlinda to please turn on your camera or your video. So we're going to have our picture taking. Ma'am Irene, hello. Mel, please turn on your camera. Rochelle. So we're going to start before we do our picture. Dr. Lance will do the picture for us. Wait lang, Doc Lance, ha? Hindi pa sila naka-camera eh.
Sige.
Ma'am Edna, welcome.
Hi, Beth. How are you?
I'm good. Dr. Lance is here instead of Dr. Joson.
Yeah, first time I attended, wala pa siya.
But Doc Lance is here.
It's okay, Lance. I know you. I'm the mom of Nicole.
Hi, tita.
So how's your where's everyone? They didn't hear?
Nasa po ako nasa Manila, nasa PGH po.
Very good. So you're finally seriously being a doctor. That's good. What's your specialty?
GS pa lang po, tita. General surgery.
Wala pang
Wala pang subspec or fellowship po.
You have the best teacher.
Yeah po.
Yeah.
Thank you.
You know that.
And you will be taking over Dr. Joson's patients.
That's good. At least we know he can always go to his father, no?
Yes.
And ask.
Ma'am Charlita, Chris, Erlinda, Mel, Rochelle, can you turn on your video so we can start and have our picture taken? Okay, turn on your camera, please. Thank you. Jeng, Erlinda, Chris, Mel, have your video so Doc Lance can start.
Actually, may prepare naman siyang lecture. Naka-record. I-play ko na lang for you. Binili naman po niya sa akin. Pero kung may questions or clarifications or kung may areas na mag-add na lang ako, parang maging interactive na lang din yung niya, yung prepare niyang recording sa na lecture for today.
Ma'am Jocelyn,
Ready na po.
Doc Lance po. Son of Dr. Joson.
Hi. First time to see you.
Hello po. Good afternoon.
Good afternoon.
And siya wala si ngayon.
Did I miss anything? Late yata ako nakapasok.
No, not yet. We're not yet started.
Okay. Anong nangyari kay Doc?
May prior commitment po kasi siya today. Di siya.
Okay. So sweet of you to represent him.
Okay, so let's get on with our picture taking muna tayo. Okay, everybody smile. And then the next will be before we ended our after Dr. Lance ended his lecture. Okay, 1, 2, 3.
Okay.
Okay. One more,
Thank
one
you.
more. Okay. Doc Lance, you may start now.
Sige. So good afternoon sa mali pumasok ako si Lance Joson or ROJoson. Wala ko nickname ko lang yung Lance. Anak po ni Dr. Joson. Wala po kasi siya today kasi may prior commitment. Pero binilin po naman niya sa akin yung lecture niya. Actually, re-record na niya yung lecture niya na ginawa niya about myths in cancer. I-share ko na lang yung lecture po niya, tapos if ever may questions po kayo in the middle of the lecture or may gusto kayo pa-clarify, please don't hesitate to raise your hand or butt in po. I-pause ko na lang yung recording ng lecture niya, tapos I'll be happy to answer po or clarify things kung as much as I can po. Okay, i-share ko lang yung yung lecture po niya since 2 o'clock na rin po. Wait lang. Nakikita po ba ng lahat yung yung shinare ko na screen?
Yes.
Okay.
Yes po.
Sige po. So ito po yung lecture niya for today. Cancer awareness and myths
Yes po.
on causation po yung topic niya for today. I-start ko na po yung lecture po.
Good afternoon.
Rinig po ba yun? Yung audio? Yung narinig po niyo? Ay, narinig po
Yes,
niyo?
yes.
Yes, Doc.
Okay, okay.
I'd like to
Yes,
welcome
Doctor.
this particular pep talk.
Thank you.
Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. So please show your beautiful faces in the video. As a reminder, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get the certificate as shown below. The link has already been placed in the chat box. Another reminder, 50 OLETE certificates will entitle one mentee or participants to a voucher for a ROJoson telemedical consultation. The voucher is shown here. Another request from Dr. Joson. Feedback to this pep talk. Please type in your feedback in the chat box during the open forum and before we part ways. Thank you. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm and perseverance. My pep talk today is entitled Cancer Awareness and Myth on Causation. This is part of my contribution to the National Cancer Consciousness Month program of the Department of Health in February. The empowerment objective is for the lay people to have a basic understanding of what is a cancer and its associated myth in causation. Here are the contents of this particular pep talk. What is a cancer? What are the different types of cancer? What are the causes of cancer? And what are the myths and misconceptions on the causation of cancer? This will be the focus of this talk. What is a cancer? Cancer is a medical disease when some of the body cells grow uncontrollably with a potential to invade the adjacent body tissues or organs and to spread to distant tissues and organs. I will amplify these pictures. So this shows a group of normal cells. And then when cancers develop, there is a multiplication or division, multiplication of the cells with no control, and then there's a tendency to invade the surrounding tissues. And then cancer can also spread to distant organs. Example here, this is the original tumor in the colon. It has spread to the lungs. Okay. Before going further, let's clarify one associated term of cancer, malignant tumor, and differentiate it from benign tumor. So what is a malignant tumor? Malignant tumor is the same as cancer. What is a benign tumor? Benign tumor is not cancer. Malignant tumors invade and spread. Benign tumors do not invade and spread. So this is the main difference between the two. What are the different types of cancers? There are more than 200 types of cancers. The type of cancers can be categorized into whether solid or liquid based on organ or tissue of origin, and then based on the specific cell of origin. Cancer can be described as solid tumors, or another term for that, organ tumors, or liquid tumors, or blood cancers. Both types are similar, meaning the solid tumors and the liquid tumors, they're similar in that they are made up of abnormal cells that grow uncontrollably. Solid tumors form a mass or multiple masses, and the liquid tumors circulate. It goes around the body through the bloodstream. Another category in the differentiation in the different types of cancer will be based on the organ or tissue of origin. Examples here will be cancers arising from the breast, brain, bone, stomach, esophagus, lymph nodes, epithelial tissues, connective tissues, muscular tissues, nervous tissues, and other organs. It has to be noted that no organ in the body is spared of cancers. So all body parts can develop cancers. So rare though or uncommon in the body are cancers of the heart, spleen, and appendix. These are relatively rare. Another way of categorizing the type of cancer will be based on the specific cell of origin. Example, there are different cells in the epithelium, or in the skin, or the lining of the wall of the intestinal tract, epithelial, or even the skin. So you have such a particular cell coming from the gland, which is called adenocarcinoma, basal cell carcinoma, squamous cell carcinoma, transitional cell carcinoma. What are the causes of cancer? The main cause of cancer is mutations or changes to the DNA in your cells. So basically, cancer is a genetic disease it is caused by changes to the gene that control the way our cells function, especially how they grow and how they divide. Genetic mutations can be inherited, hereditary, but only in 5 to 10% of instances. You have to remember that, 5 to 10% of instances. Majority are not inherited. They occur after birth as a result of environmental forces. These external causes, which are called carcinogens, can include the following: physical carcinogens like radiation and ultraviolet light, chemical carcinogens like cigarette smoke, asbestos, alcohol, air pollution, and contaminated food and drinking water, biological carcinogens like viruses, bacteria, and parasites. So let's now go to the main topic for today, misconceptions and myth. Misconceptions about cancer causation are often rooted in outdated theories. They can cause undue stress, confusion, and interfere with effective prevention and treatment. Here are some common cancer myths on causation with some evidence-based information. When I say it's a myth, it's a belief that has no strong evidences to support it. The listing of the myth that I'm going to present here come mainly from the National Cancer Institute. First myth is cancer always genetic? If someone in my family has cancer, am I likely to get cancer too? The answer is not necessarily. Cancer is caused by harmful changes or mutations in the genes, but only about 5 to 10% of cancers are caused by harmful mutations that are inherited from a person's parents. The remaining 90 to 95% of cancers are caused by mutations that happen during a person's lifetime as a natural result of aging and exposure to environmental factors such as tobacco, smoke, and radiation. These cancers are called non-hereditary or spontaneous cancers. So the answer to this question is cancer always genetic? Not always, in only 5 to 10%. Majority, 90 to 95%, are not hereditary. If no one in my family has had cancer, does it mean that I am risk-free? I'm not at risk to develop cancer? The answer is no. Based on the most recent data, about 30% of men and women will be diagnosed with cancer at some point during their lives. Most cancers are caused by the genetic changes that occur throughout a person's lifetime as a natural result of aging and exposure to environmental factors such as tobacco, smoke, and radiation. Other factors such as what kind of food you eat, how much you eat, and whether you exercise may also influence your risk of developing cancer. Is cancer contagious? In general, no. Cancer is not a contagious disease that easily spreads from one person to another. The only situation in which cancer can spread from one person to another is in the case of organ or tissue transplantation. A person who receives an organ or tissue from a donor who had cancer in the past may be at increased risk of developing a transplanted related cancer in the future. However, in actuality, the risk is very low, extremely low, about 2 cases of cancer per 10,000 organ transplants. Usually, doctors do not use avoid the use of organs or tissues from donors who have history of cancer. Do cell phones cause cancer? No, according to the best studies completed so far, cancer is caused by genetic mutations, and cell phones emit a type of low-frequency energy that does not cause damage to the gene. Does microwaving foods in plastic containers and wraps release harmful cancer-causing substances? No, the answer is no. Plastic containers and wraps labeled as safe for use in the microwaves do not pose a threat. Will eating sugar make my cancer worse? Will eating sugar cause cancer? No. Although research have shown that cancer cells consume more sugar or glucose than normal cells, no studies have shown that eating sugar will make your cancer worse, or that if you stop eating, your cancer will shrink or disappear. However, a high sugar level or diet may contribute to excess weight gain, obesity, and obesity associated with an increased risk of developing several types of cancer. Can artificial sweeteners cause cancer? The answer is no. Does trauma cause cancer? Does trauma to the breast cause cancer? Again, the answers are no to these 2 questions. Does negative thinking or attitude cause cancer? Does stress, anxiety, depression cause cancer? The answers here, no and no. Will dyeing hair cause cancer? No. Since the 1970s, most of the harmful chemicals that have been identified have been removed from hair dyes, and modern studies have found no increased risk of cancer in people who dye their hair. Do underwire bra cause breast cancer? The answer is no. This is related to the question of trauma causing cancer. No. Do antiperspirants or deodorants cause breast cancer? The answer is no. The studies have found no evidence linking the chemicals typically found in antiperspirants and deodorants, which is usually the aluminum substance, with changes in breast tissues. Do frequent ejaculation cause or prevent prostate cancer? Frequent ejaculations do not cause prostatic cancer. Though some studies are showing protective effect of frequent ejaculation on prostatic cancers, when they say protective, it is meant to reduce or prevent prostate cancer. But these studies, the results of these studies have to be validated yet. Can cancer surgery or tumor biopsy cause cancer to spread in the body? The chance that surgery will cause cancer to spread to other parts of the body is extremely, extremely low. There is more benefit in doing a biopsy than not doing it, as a definitive diagnosis is needed for a proper treatment. So summary and takeaway in this particular pep talk, I have discussed the following: what is a cancer, what are the different types of cancer, what are the causes, and I have also presented the myth and misconception on the causation of cancers. Okay, is cancer always genetic? Am I free from cancer if I don't have a family history of cancer? Is cancer contagious? Do cell phones and microwaving foods cause cancer? Will eating sugar make my cancer worse? Will eating sugar cause cancer? Can artificial sweeteners cause cancer? Does trauma cause cancer? Does trauma to the breast cause cancer? Does negative thinking or attitude, stress, anxiety, depression cause cancer? Will dyeing of the hair cause cancer? Do underwire bras cause cancer? Do antiperspirants and deodorants cause breast cancer? Do frequent ejaculations cause or prevent cancer? Can cancer surgery or tumor biopsy cause cancer to spread in the body? So these are some of the myth and misconceptions that I have discussed. If you know of other myth, you can bring it up during the open forum. Takeaway in relation to patient empowerment: be always in touch with reliable medical information on myth in cancer causation. Knowledge is power. It gives power. Use the 4 Ks for patient empowerment: kaalaman, kapayanan, karapatan, and kapangyarihan to gain greater control over decisions in preventing the myth in cancer causation in affecting health management. With this, I end my pep talk. Cancer awareness and myth on causation. I hope I have empowered you to have a basic understanding of what is a cancer and its associated myth in causation. Before we go to the question and answer portion, reminder, take the online learning evaluation test exercise for mastery of learning and have a perfect score to get a certificate. 50 Olete certificates will entitle one to a voucher for a free ROJoson telemedical consultation. Please type in your feedback in the chat box during the open forum and before we part ways. And then let's now have a group picture taking before we start the QA and interactions.
Okay, so yan po yung lecture na prepare na dad ko. Medyo marami siyang diniscuss na myths, no, about cancer. If let's just discuss it more kung may questions po or clarifications mamaya sa open forum. Pero Abet, mag-picture po yata ulit.
Yeah, picture taking muna tayo, Doc Lance. So, yung screen muna.
I-stop share ka na lang muna to. Ang dami na pala sumali.
So the floor is now open for open forum, comments, suggestions, sharing of experiences, etc.
Okay, picture taking muna po tayo. Okay, 1, 2, 3.
Welcome to the U.S. Department of Agriculture's Urban.
Ano rin po kayo, no? Mag-take in po kayo ng picture if in case na hindi po mag-work yun sa akin, ho? Ate Rides, please do so.
Nag-take din ako ng picture. Papadala ko sa kay
Okay.
Okay, so yung lecture today medyo basic lang, parang introduction lang po siya to cancer, for more of cancer awareness po and empowerment on knowing yung different kinds of cancer. So pero ano lang siya, parang basic introduction lang siya, as well as the myths, no? Marami kasi tayong inisip na saan ko kaya pag may cancer, saan ko kaya nakuha yung cancer, ano kaya nag-cause ng cancer, ba't nagka-cancer itong ganito. Lagi natin di ba? Iniisip kung paano siya nangyari. And dapat when we do this, isip rin natin na marami ding myths na hindi rin proven by science or by research yung mga different causes. Kaya importante na alam din natin yung mga to as discussed earlier. So don't worry, marami pa naman tong additional na lecture and information in the succeeding na mga pep talk. I think yung next ay myths on treatment and discussion on treatment po yung i-discuss. I-clarify ko lang po sa dad ko po yung final topic for next week. So kung may questions po about yung lecture po kanina, I'll be happy to entertain them for clarifications po. Meron po ba on the top of your heads po na gusto niyo po i-bring up or discuss? Or malinaw naman po ba yung lecture kanina? So
Yes.
medyo straightforward naman po siya. Yung different kinds of cancers, yung mga solid tumor cancers, such as yung mga breast cancer, yung mga lagi natin kita, yung mga bukol actually, na sinasabi yung mga solid, tapos yung mga liquid, yung mga sa bloodstream na hindi naman natin actually nakikita pero nasa katawan na pala ng tao na nakikita lang on blood tests and mga different modalities po. And then yung next po na diniscuss niya bago pumuntang myths.
Doc Lance,
Apo.
Chris Nisesha is raising her hand. Maybe she has a question for you. Chris,
Sige po.
take the floor.
Hi, good afternoon, everyone. Good afternoon, Doc Lance.
Afternoon,
Thank you
ma'am.
for taking over, Doc Coson. Happy po kami. Yun, ang actually, gusto ko lang din i-share kasi nung isa yan sa fear namin, yung myth na na-discuss kanina ni Doc Coson na yung kapag nag-undergo ng biopsy, kasi yung sa akin kasi nung na-diagnose ako po, medyo malaki na siya. Ngayon, yun din yung naririnig namin, yun yung fear namin before kami nag-decide talaga na magpa-biopsy. Kasi ang sinasabi nila pag nabutas na yung mismong bukol, parang mas mabilis na daw siyang kumalat all over the body. Kaya yun po yung gusto kong i-clarify. Pero based on sa sinabi ni Doc Hosan, hindi siya related. Tama po ba?
Opo, yung sinabi niya kanina, hindi naman po usually directly related po yung pag biopsy, and importante din na sinabi niya yung benefits po kasi that getting a biopsy for proper treatment greatly outweighs the risk po of of greatly outweigh the risk. Pero usually pag bina-biopsy po kasi like for different cancers, yung biopsy site when they will eventually undergo definitive treatment po or yung surgery po, sinasama po yung biopsy site just to make sure adequate po yung margins and yung wala naiwan like yun yung kung saan nag-biopsy dati, just to be sure. Pero mas common to sa mga medyo deeper medyo mas common to sa mga soft tissue mga sarcoma ganun. Study show na importante na tanggalin yung previous na biopsy site na when they undergo the surgery po. Pero yung for the it will cause the cancer to spread, sobrang hindi naman po ganun ka related po, but it is more crucial na we obtain the biopsy, the definitive biopsy, kasi yun yung magsasabi sa atin kung cancer po ba talaga yung pina-face natin or hindi, and it will lead us to the proper treatment po. Case wala tayong like blinded po tayo sa diagnosis po without the biopsy. Yan po. Sorry, nasagot ko ba yung question?
Yes po. Thank you so much, Doc.
Sige.
Follow up, sorry po. Lubos-lubusin ko na.
Okay.
Halimbawa, Doc, nagpa-biopsy ka. Tapos, after nun, kasi yung fear kasi namin kapag as patient, ang fear namin yung kasing maano na yes, it is cancer talaga yan. Yun yung pinaka-fear namin na malaman po. Kapag nag-biopsy ka, nag-undergo ka ng biopsy, tapos nag-decide ka na ayaw mong magpagamot, mas magiging mabilis ba yung pagkalat ng cancer?
Kapag mas
Kasi
mabilis na
parang nagpa-biopsy ka na parang sabi nga nila na nagalaw na yung bukol mo, nagkasugat na siya kasi kukuha ng tissue. Tapos may mga cases kasi nung natatakot silang mag-undergo dun sa medication and surgery. Mas ibig ba sabihin nun, mas mapapabilis yung hinog nung cancer mo? Ganon?
hindi po hindi po ma'am yung mas mapapabilis nga po yung yung actually yung treatment po kapag may biopsy result po than yung sinasabi po na mapapabilis yung pag-spread ng cancer pag biopsy po. And as yun nga, as recommended by lahat ng talaga cancer na societies and researches po, crucial po talaga yung obtaining a biopsy result po in managing the cancer po. Kasi kung wala po, hindi siya properly address po talaga yung type of cancer. Kasi as discussed kanina, ang dami talagang types of cancer po, and each one has its own specific na treatment na best po para sa kanya for the proper response din po.
Thank you, Doc. Thank you for the clarification po.
Thank you. May other questions pa po?
Do you have any questions or who wants to share experiences with regards to this lecture?
Tama po yun, dami ko rin na encounter na sinasabi parang yung trauma to the breast, yung nasipa, natamaan, tapos parang na-relate po sa pag-grow ng cancer. So, ayun, importante na back of our minds na siya, hindi siya talaga backed by evidence or research na yung traumatic causes of cancer yung cause, kasi it's more of yung as discussed, yung genetic mutations po talaga ng katawan natin is the majority na causes of cancer in our body, or more than external causes or yung genetics po. Actually they play a 5 to 10% more of the genetic mutations due to how we live our lives, then yung radiation exposure, yung yung smoking, yung mga proven na may direct effects on our gene mutations po.
Grace, do you have any questions? Any follow-up question?
I
Thank you,
do.
Miss
I have a
Bell.
question.
Yes po, ma'am.
Go ahead,
Hello.
ma'am. Go ahead, Ma'am Ed.
Mhm.
Sige po.
This is my question. What is the advantage of, or what's the difference? No, not difference. What is the advantage of having a PET scan over a CT scan assisted biopsy?
Yung PET scan po kasi positron emission, tomography po, if I'm not mistaken. Ano po siya parang it detects yung mga cancers in our body, pati yung mga yung mga kung may distant mets po, it's a whole body scan po kasi that detects yung activity po ng cancers in our body. Yung CT scan po kasi na na test, it is parang more for can you tell us more hindi yung whole picture like the PET scan na mas directed po siya na area where focus on the relation to the anatomy, yung mga vessels.
So the CT scan is more targeted, para specific.
Depende din po. And with the CT scan, meron din po kasi iba't ibang contrast na ginagamit. Para mas specific po talaga. Yes, ma'am. Parang ganoon po. Mas
Pero
specific
yung
siya to specific tumor na hinahanap po. And may dami po kasi modalities. We have the ultrasound, we have the CT scan, we have the MRI, and the PET scan po, which are yung advantages niya for iba't iba po yung advantages niya depending on the kind of tumor or you are looking for po.
sige, okay. It's clearer. Sige. Thank you.
Thank you.
Yes, Chris, you may go ahead for your question.
Doc, follow up lang po ako sa question po ni Ma'am Edna. Sa mga tulad po namin na na naging cancer patients po, mas maganda ba pag magpe-PET scan kami once a year, ganyan?
Usually po sa mga actually recommendations po, depende rin sa yan sa sinusundan natin na recommendations or guidelines. Kapag usually breast cancer po yung pina-face po natin, hindi naman siya yung kasama sa recommended na screening po or surveillance po for breast cancer po. Usually nga pag breast cancer, usually just use the mammogram or ultrasound dun sa breast, and then the CT scan for the we can use the CT scan for the chest and the abdomen to check for the liver and the lungs po, as well as the bone scan and the ayun po, and the bone scan. Tapos kasi yung PET, if I'm not mistaken, yung PET scan kasi sobrang expensive po yun, nasa may 50,000 yata, 60,000 yung price range nun as compared to yung mga depende rin sa cost ng sa CT scan, 20 or less po. Tapos yung ultrasound nga lang mas cheaper and yung mammogram po, which is just the X-ray film. So hindi parang yung yung cost po kasi ng PET scan yearly po, parang pwede naman ibang modalities just to check and to for surveillance po of the cancer. And usually pwede ring symptom directed kung may nararamdaman na pain sa bones or sa abdomen or may respiratory changes. We can also test that symptom directed po yung testing. Actually yung surveillance nga is yearly mammogram kung wala naman ibang symptoms na ibang problems po.
Thank you, Doc.
Inaano din kasi yung cost tsaka yung benefit, cost versus benefit dun sa sa mga syempre sa mga imaging modalities kasi medyo mabigat din kung magpa-PET scan din yearly po. Sobrang
Opo, tama.
Expensive.
Actually, Doc, tinuro yan sa amin ni kasama
Opo.
yan sa lesson po namin ni Doc Joson kung 'di ba tama yung A, B, C, yung
Yes,
aanuhin mo yung accessibility plus cost plus yung risk plus yung importance dun sa ano para ma-weigh po ng patient kung
yung, opo,
ano paano
B-
mag-take action.
yung BRCA po. Yung
Ah, yes, opo, tama
benefit,
po.
risk, cost, and yung accessibility.
Yes po, Doc. Thank you.
Naturo.
Doc, one more question.
Yes po, ma'am.
Is PET scan covered by PhilHealth?
Ah, sorry,
No,
ma'am.
no.
Di ko masagot kasi wala kaming PET scan sa PGH.
Okay, sige.
Pero I'm
Okay.
not sure sa ibang places kung saan na may PET scan na may ano, na may kung covered ng PhilHealth. Actually, bihira lang ako makita ng PET scan actually kasi nga wala siya sa amin tapos parang dumadating na lang yung ano ibang patient sa amin may dala ng PET scan from outside. Parang whole body scan na siya na ano ayun, ma-check yung iba't ibang ano each and every organ po ng ano kung may ano increased uptake or activity kung suspicious for malignancy po.
Okay.
Usually
Sige.
pero kung
Thanks.
usually kung ano kung yung mga previous test po such as the CT scan or MRI or bone scan na hindi po nila ma-commit to a the hindi nila ma-commit yung impression nila yung findings or diagnosis tsaka lang parang nagre-recommend sila ng ano parang additional test tapos yun na siguro yung wala yun yung last resort na ano talaga makapagsabi po yung PET scan po talaga pero yun nga yung accessibility po niya talaga yung cost talaga niya sobra taas po
Yeah.
talaga yung hirap yung accessibility tapos yung cost siguro 4 na plus sign yun sa ano niya sa BRCA niya na na model po.
Yeah. Okay, thank you.
Thank you.
Anybody who has questions or experience to share?
Doc, sorry.
Opo.
Since wala pong ibang nagtatanong, pwede pa ako?
Good.
Sure.
Sure.
Anihin ko na, paano ko ba anuhin na 'to? Firstly, si inay kasi actually nandito siya, si inay. So, nung nagpa-X-ray siya, parang may nakita daw na, possible bukol. Ngayon after nung X-ray pina-CT scan.
Opo.
Tapos ang hindi pa din na-rule out, parang malabo, maliit, parang gano'n po yung ano, yung, result. Tapos after nun nakalagay dun sa recommendation po, ipapa-PET scan.
Saan po yung bukol? Sa lungs po ba nakita?
Opo, Doc, sa lungs po.
Opo. Pag sa lungs po kasi, sa X-ray lang po na-detect. Usually mag-recommend ng CT scan for mas makikita kasi dun sa chest CT scan yung if ever may bukol dun the chest X-ray. Kung may nakita man, next step usually is either a biopsy no lung mass kung makita ko accessible pero kung hindi ayun pwede rin mag-proceed to PET scan after kung hindi pa rin makommit ng CT scan. Pero usually pag CT enough na po kasi magsabi ng kung mukhang metastatic or kalat po ba or hindi yung nakita sa lungs po.
Okay po, Doc. Actually nakalagay kasi, Doc, well-defined nodule in the right upper lung loop with surrounding fibrosis, tapos subsegmental atastasis, a few subcenter nodules. Tapos ang sabi niya, suggest to follow up CT scan after 3 months or further evaluation with PET scan.
Usually, yun yung mga ganyang klaseng bukol, parang sinasabi nila for surveillance CT scan, like after 3 months, pwede i-repeat to check kung lumaki po ba yung bukol, kung lumiit, parang on observation po siya. Pero ayun nga, para di nila ma-commit with CT, kaya sila recommended ng PET. Pero kaya yun nga lang, kung magpe-PET CT pa, parang 3 times yung
Opo.
presyo ng CT scan. So, hindi nila, by CT, hindi nila ma-commit kung cancer, kung metastatic po ba yung nakitang bukol. Kaya either can do a surveillance after 3 months po yung ibang rin-recommend na iba kung hindi kaya mag PET CT, PET scan.
Okay po, Doc. Thank you. Pag mga ganun po ba, kasi like she's already 65 years old, ever na pag nagpa-biopsy, kinakaya pa ba ng mga ganyang edad?
Kaya naman po, ano naman siya parang CT guided biopsy siya gagawin. Para siyang CT scan, tapos isi-CT scan siya. Tapos doon nila ita-target yung biopsy niya. Pero depende rin sa size kasi parang may sila criteria sila for kung kaya nilang i-biopsy or hindi. Usually yung radiologists na yung gumagawa ng yung mga CT guided na biopsy po. Na procedure. Kasi kailangan nila gamitin yung CT scan para sure na accurate po yung pag-biopsy po nila dun sa nakitang bukol sa lungs. Parang option din po siya na pwedeng gawin.
Sige po. Pero actually, naman, babalik siya sa doctor niya, nakaschedule yun po, mag-aano kami kung anong pwedeng gawin. Thank you, Doc, sa advice.
Thank you, ma'am. Okay. Ibang questions po ba sa others or clarifications po?
Any more questions? We still have 15 minutes.
Miss Beth?
Yes,
Um,
please.
actually, iba siyang, parang Dok, anong insights niyo dun sa yung mga lalaki na yung nag-adolescence, yung breast nila 'di ba namamaga, masakit. Paano namin po as mother, paano po namin Dok malalaman kung normal lang ba yun or may yung red flag na siya?
Yung pinaka-red flag naman pagdating sa mga breast, kung may palpable na na bukol or na lump na pwede mo suspicious ng cancer. Yung mga breast na lumalaki, pwedeng kasi due to yung hormones sa body. Kung syempre pag namamaga, watch out for kung namumula ba, kung may masakit, kung may nana, baka may underlying infection din po siya. Pero kung yung lumalaki lang, yung breast na symmetrical, ibig sabihin both breasts lumalaki siya parang sabay and the same time. Baka due to yung hormonal changes po sa katawan po. Yung pinaka-red flag po talaga yung may nakakapa po talagang bukol. Kaya yun, importante yung self-breast examination. Although hindi masyadong common sa mga lalaki yung breast cancer, pero possible din po kasi siya. Kaya yun yung talagang i-watch out for kung may nakakapang bukol sa breast po. At ayun, yung signs of infection po kung meron, baka may sugat or may pimple na pumutok tapos namamaga po siya. Pwede rin kasi siya mag-cause ng inflammatory changes or lumalaki po yung breast due to the swelling po.
Okay po, Doc. Thank you again.
Doc Lance, I have a question.
Ayun.
Pag ang isang babae or meron siyang PCOS, di ba hindi siya masyadong nagme-menstruation?
Irregular po.
Irregular menstruation, yeah, that is correct. Is this a cause for an alarm? Lalo
Yung
na pag hindi pa masyadong nagpapa-check up siya pero talagang irregular yung menstruation. Dahil nga sa PCOS niya. So, pwede ba yun? Is it a myth or a fact na baka magkaroon siya ng, you
kan-
know?
mas hindi siya masyadong related sa cancer po. More on, hormonal changes. Pero yun nga, usually kinokontrol po yun ng mga OB with hormonal, with yung mga pills, yung mga hormonal pills po, para ma-regulate po yung yung menstruation po.
Okay.
Pero sa cancer, hindi naman siya masyadong, hindi siya related.
Related. Okay, thank
For the
you.
hormonal siya. Polycystic ovarian.
Any more questions? There is a question from Ma'am Jackie Tong. If a pregnant woman is diagnosed with breast cancer, how do you go about the treatment?
Sa instances na to, important to take note kung anong trimester po yung patient during the pregnancy, kasi nga yung kasi during the first trimester, medyo yung delicate pa yung pregnancy, madali siyang pwedeng yun nga, yung pregnancy, magko-complications sa pregnancy pag early on sa early on sa pregnancy, yung paano yung cancer. Pero during the later trimesters po, usually pwede na po undergo kung gusto yung mga surgery, mga for the breast CA po. Kasi hindi yung chemotherapy, yung question din kasi kung magki-chemotherapy po after, pero hindi pwede pag in the first trimesters po, kasi doon pa lang yung organogenesis, yung pagbuo ng yung vital organs po ng baby. Yun po yung benefits and pa rin risks po for the mother and the baby po.
Thank you.
Thank you, Ma'am Jackie Tong.
Thank you too.
Who else has a question, clarification? Do not be shy to ask Doc Lance. Ate Chuchi, do you have any question for Doc Lance about the topic? Okay, thank you. Ma'am Jocelyn, do you have any questions in mind?
Ay, wala.
Okay, thank you.
Yun. Kung may questions pa kayo,
Yes,
Ay,
Ma'am
ito may
Edna, did you
naisip
still have
ako.
question?
May
Yes.
naisip ako.
ano yun po?
Doc,
Apo.
can you say na mas accurate ang CT scan for yung mga tumor sa breast kesa sa mammography? Comparing CT scan and mammography.
Usually yung po namin, actually sa breast, preferred namin modality po talaga is the mammography and the breast ultrasound po for diagnosing yung sa breast talaga. Yung CT scan mas ginagamit po yun sa pag hinanap namin yung mga chest na metastasis, yung mga sa liver. Pero sa breast itself, mammography and ultrasound po talaga yung namin. Yung gold standard po for yung modality for the cancers of the breast po. Marami. Ayun.
If two hospitals na ultrasound, magkaiba ang resulta. One says benign and the other says baka cancer.
Opo.
Pero ayaw ng patient magpa-mammogram. Ano na next step?
Yun nga po eh. Yung kasi, ultrasound po kasi, operator dependent po kasi. Kung sino yung nag-ultrasound at nagbasa, yun yung masusunod na magiging resulta po kasi na minsan may discrepancies po talaga. Usually sa practice po namin, based sa i-correlate namin yung ultrasound findings po talaga with the clinical picture po, with the physical examination of the breast po. Kasi masasabi sa physical exam masasabi mo kung mas mukhang benign or mas mukhang malignant po yung bukol. For example, kung may minsan may discrepancies po talaga for yung mga ultrasound results done in different places po. Pero kung mas nagtutugma po sa sa physical examination po ng doktor, mukhang yun po yung yung best na maging basis for treatment po sa patient. Kaya hindi pwedeng based lagi. Yun nga, sa dati ko, ayaw niya yung tinitignan po agad niya yung resulta ng mga mammogram, ultrasound. I-physical exam po muna yan kasi para hindi po siya ma-sway by the results po of the imaging tests po. Kasi or nagkaroon po ng mga test na ganun po, clinical po talaga yung basis po namin for diagnosing and treating po. Parang ancillary or additional lang po dapat yung mga yung mga imaging tests po talaga.
Thank you, Doc. Pareho kayo ng comment ng dad mo. I'm just re-asking.
Medna, do you still have question?
Yes po, ma'am.
Ate Chuchi, do you have a question?
Naka-mute po yata si ma'am.
Unmute.
Ayan. Can you hear me?
Yes, ma'am.
Yeah, I just thought of this now. Some people who they're also asking pala if eating red meat will really have an effect on the body of somebody who has had cancer. Is it true that we should avoid red meat because we already had cancer?
Red meat, wala po ako na-encounter, ma'am, na nag-cause siya directly sa cancer. Although I have to check the evidences po. Yung sinasabi po nila yung mga di ba, yung mga sa ihaw, yung mga yung mga
sunog, mga sunog na
parang pwedeng
parte, tsaka yung
parang sinasabi yung carcinogenic po yung mga ganun po. Yung mga grilled po na sobrang sunog po yung carcinogens po.
Masarap naman.
Opo, kaya lang yun. So, you have to double check din po yung researches and evidence po yung kung directly related po sila to that. Pero nung red meat lang naman po, parang wala pa naman ako na encounter pa na po siya, causes cancer po.
Okay. Kung walang masyadong magtatanong, I just want to showcase our family, no? Kasi I know that cancer is not hereditary from the lectures, but in our family it is very, very strong.
Yes. ma'am.
No? It's very, very strong, which makes us believe na talaga parang hereditary in our particular family, because well, it started with my paternal grandmother. She had breast cancer, and then all her children, so yung second generation, wala. It came out in the third generation, kami yun. All the 7 children, nagkaroon ng history, bawat isang pamilya, and all girls. Mostly 2. Kasi dati, uso yung maraming children, no? So, dami talaga namin dahil marami kaming, marami kaming girls. The girls in the family of the first boy, I think about 2 or 3. The girls in the family of the second child, ganun din. And my father came in 5th, and in our family, 2.
Yes.
And I was the first one to have cancer at age 38. And then the next one was my sister, but she had it very late. Kaya lang, hindi na-detect. Well, hindi niya na-detect. Hindi niya na. After 5 years, it spread very, very fast to her liver.
Yeah po.
And so mysterious. Kasi,
Opo. Actually, yun nga. Yung talaga may role po din talaga yung genetics po. Pero hindi siya yung majority po talaga ng cause. Pero yun, some, yun nga, families may strong history of cancer in the family. Parang yung genes po kasi, ayun, underwent yung mutations na po kasi. So, kaya lumalakas talaga yung risks for cancer in the family na napapass on from generation to generation. Sabi ko niya 5 to 10%. So medyo meron pa rin naman po talagang role po talaga yung genetics po. Actually, kung may strong history of cancer and parang nagka-cancer in a young age, usually may genetic testing din po na pwede pong gawin na just to to double check kung kasi hindi kasi usually nangyayari na sobrang bata nagkaka-cancer. And ayun, so baka may something talaga sa genes kaya can undergo gene testing. However, mahal din po yung mga ganun po kasi yung genetics na testing studies po. Pero yun nga, kung strong family history po talaga in bata, talaga, may gene mutation na po for that particular cancer. Kaya recommendation ay talaga early detection po talaga na cancer pag alam mong high risk po talaga yung family po or yung relatives po. And the best way to treat po talaga ay ma-detect early and early treatment po before yung pwede siya mag-spread po to the other organs po of the body po.
In a way, it's a wake-up call to everybody in the family. So parang now we are aware na if we know that it's very strong in our family history, then you have to be careful. I mean, be aware always of what is happening in your body, di ba?
Yes po.
Yeah, so in a way, that was what happened. A good thing that happened to us.
Yes po.
In my case, I had it twice pa. So I have had 2 mastectomies na.
Strong po
36 years apart.
Hindi rin talaga pumasabi.
Yeah.
Kung talaga.
Okay.
Recur po talaga or ibang part.
Thank you.
Perfect
Thank you.
example. At saka important to note kung nangyari siya in one organ like the breast, hindi mangyayari sa iba kaya pwedeng maraming areas na pwede naman magkaroon ng cancer as discussed earlier. sa colon, sa brain, sa blood, sa ano. Kaya ayun, early detection po talaga yun, ano, awareness and ano, ayun, know your body na ano, they ba talagang ano pa, seek ano na lang, consult, kaya, or ito, kaya may empowerment para ano, to increase awareness and ano, know when ano, what to do or the next step po. Kasi hirap na mapabayaan at ano, mapatagal kasi baka too late na in the end na ano.
That's true. That's why this sessions are very important.
Yes.
Even if you've had it already once, then should be more aware of what you should do. Di ba? Be more
Proactive and know what to
Correct.
watch out for po.
Thank you.
Thank you po, ma'am.
Doc Lance, meron bang test yung just to check genetically if you are inclined, or katulad yung sinasabi ni Ate Chuchi na sa kanila very strong?
Opo.
Meron bang test just
Meron
to
po, ma'am.
determine?
May mga gene testings,
Mm-mm.
gene testing po yung ano, na available po. Pero mga for the breast, for the colon, kasi may specific genes po talaga yan na ano, nagmi-mutate that causes the cancer in those specific na parts of the body po. So available naman po siya. Yun ko lang kung saan kasi hindi ko rin masyadong ano, familiar kung saan exactly and how much yung cost. Pero mayroon tayong available in ano, dito sa Philippines naman po, ma'am, na ano, genetic testing na po. Pero mahal. Alam ko may price. Ano talaga siya? Pricey pa po siya
Pricey.
sa ngayon po. Mga genetic testing po.
Okay. Ma'am Edna, will you add anything?
I'm not sure if it's a valid question, but in lung cancers, is there such a thing as fast growing or slow growing, or meron bang ganun?
May mga ano talaga, pag cancer kasi may mga ano specific na histologic types na aggressive and not so aggressive po. Ayun. Pag cancer, pag lung kasi alam ko kadalasan aggressive po talaga yung mga lung cancer po eh. Tapos pag di mo siya readily kasi ma-detect until ma-test mo, parang mahirap siya ma-detect early. Pag ano, kasi 'di ba? Hindi yung lungs kasi hindi mo agad makikita or makita mo may bukol pala. Sa mga test po talaga or pag may symptoms na po kasi baka ayun may ano na malaki na po talaga siya kaya siya nagka symptoms po no ano mas madali kasi ma-detect yung mga yung ano may early symptoms po talaga ng cancer, parang bukol, mga sa colon, mga bowel changes.
What are the symptoms normally for lung cancer?
For lung cancer,
Or generally, what are they?
pwedeng ano ma'am, meron kang shortness of breath, difficulty of breathing. Pwede kasi nagkakatubig ka na sa lungs mo due to the cancer. And pwedeng magka hemoptysis or ubo ka ng blood. Pero non-specific pa rin po kasi pwedeng other causes din such as tuberculosis. Ganun. Mga respiratory symptoms po mostly yung magpe-present po yung sa sa lung CA po. Pero most common pa rin po na lung CA ay metastatic po talaga from another organ po talaga yung pinaka-cause na nagkakabukol po sa lungs. Then primary lung tumor po talaga.
Doc Len, siguro na-miss out ko to. May question kasi si Ma'am Jackie to. What are those tests, for example? Maybe
Ayun, tama po yung sinabi ni Ma'am Chris sa yung BRCA testing na tinatawag po. Test for kung may BRCA kasi prone ka talaga to getting the breast cancer po. Tapos may iba't ibang genes specific for other cancers in the body.
Chris Nisea said BRCA po.
Opo, more for the breast po kasi yung yung
Okay.
BRCA testing. Ang dami din for the colon, yung KRAS na gene. Mas maraming genes yan na mga sobrang komplikado po talaga yung mga genes na Pero basta basically genetic testing po.
Okay. There is another question from Ma'am Jackie Tong. Is it true that if cancer strikes an elderly person like in their 80s, the growth and spread is usually slower?
Hindi naman po related to age yung growth ng cancer. It's more of the parang yung sabi ko histologic type niya. Kung meron kasi mga types of cancer na talagang aggressive po talaga, yun yung fast growing po talaga and easily na mutate. Kung yung mga not so aggressive, siguro mas sila mas mabagal po yung yung progression po ng cancer. Actually, lahat ng cancer kasi kanya meron kasi siyang specific na characteristic And ayun nga, depende din on yung which organ yung involved, such as for example, yung mga thyroid, hindi naman siya as fast growing as other cancers or masses in the body. Yung sa breast, pwedeng matagal din po. Pero yung yung iba sobrang bilis lang, mga aggressive types pa ng cancer. Meron, actually, ayun nga, sobrang daming mga based on histology po kasi nila yung mga high grade. May mga high grade talaga po na cancers po, pero sobrang daming information po na yung mga high grade na cancer types and yung mga low grade or not so aggressive types po.
Okay. May questions pa po tayo?
Baka si Therese may question.
Therese, do you have any question?
No questions.
If you don't have any question,
Opo.
Doc Lance, we may call it a day or what?
Therese is your sister, right, Doc?
Opo.
Can we see her? Can we see her?
Therese, can you turn on your video? And that's
Hi.
Therese.
Hi, Therese.
Chinese po sa akin.
Question is,
Hi. You look like your dad.
Thank you. Ito,
Nagsa-Chinese ba kayo sa bahay? Chinese speaking?
no.
No.
Yeah, I told our dad nga to teach us. Ayaw niya eh.
Talaga? So English
Oo.
speaking kayo from kids up to now?
Taglish kami sa ba.
Taglish. Wow.
Ito, may question ako for Doc Joson. Doc Joson, di ba nowadays, sabi nila na too much screen time or digital can cause cancer. What are your thoughts on that?
Sabi nga kanina, cellphone, hindi siya myth. Siya yung mga
Hindi kami. Myth siya.
na cancer. Wala pa naman proven na na yung screen time. Baka mas off-ta yung problema ng mga tao ngayon for the too much screen time.
Ako, I have glaucoma. Tinanong ko na many doctors, specialists, kung yung bang screen time ko sa laptop and cellphone will it deteriorate my glaucoma. Ang sabi naman, hindi.
No effect naman daw po sa
Oo, pero natatakot pa rin.
Yan. Pero sa screen time at sa cancer, wala naman wala pa naman na direct
Connection na, okay.
Kala nga natin dating cellphone pero debunk na.
How about microwave? Using microwave?
Yung microwave, ano kasi po si microwave eh, radiation din po siya at at the end of the day. Pero sobrang yung pag microwave naman sobrang late ng radiation involved po sa microwave. Kaya parang hindi siya significant enough po to cause cancer unless ang taas po
kasi-
talaga ng yung radiation exposure po. Pero pag microwave, you need the higher amounts of radiation po to cause significant gene mutations po.
Kasi that's one gadget na I cannot live without. Pero banned na daw sa Japan. I
Talaga.
don't know kung totoo.
Hindi ko rin po sure kung totoo po.
Thank you for the chat.
Okay.
Tapos na tayo.
Okay, if you have any other questions, we may call it a day, Doc Lance.
Bye-bye.
Next week po yata
Bye-bye.
treat and myths on treatment yung balak i-lecture po.
Okay, thank you.
Thank you po.
Thank you so much, Doc Lance.
Bye-bye, Doc.
Thank you for
Bye-bye,
attending.
Denise.
you.
Bye-bye.
Thank you
Marami
for
po
taking
Thank you,
over.
Doc.
Bye-bye. Thank you.
Thank you for the learnings. Thank you so much. Thank you, everyone.
Thank you.
You may end it, Doc Lance.
Okay, thank you.